Dysphagia refers to difficulty swallowing, making it hard to move food or liquid from the mouth to the stomach. It can range from mild discomfort to severe blockage that prevents swallowing altogether. Dysphagia is not a disease but a symptom of an underlying condition and can affect people of all ages, though it is more common in older adults. Types of dysphagia or pharyngeal dysphagia. High dysphagia. Difficulty starting the swallowing process in the mouth and throat. Often caused by problems with the muscles and nerves that control the throat pharynx and the area where the esophagus and throat meet. Esophageal dysphagia. Low dysphagia. Food or liquid gets stuck or has trouble moving down the esophagus. Typically due to issues with the esophagus itself, such as narrowing or blockages. Symptoms of dysphagia: choking or coughing when trying to swallow. Sensation of food being stuck in the throat or chest. Pain while swallowing. Odynophagia. Drooling or spilling food from the mouth. Hoarseness or change in voice. Regurgitation of food or acid reflux. Unexplained weight loss or dehydration. Frequent heartburn. Frequent respiratory infections or pneumonia from aspiration. Causes of dysphagia or pharyngeal dysphagia. Neurological disorders. Conditions like stroke, Parkinson's disease, multiple sclerosis, or cerebral palsy can weaken the nerves and muscles used for swallowing. Muscle disorders. Disorders such as myasthenia gravis or polymyositis affect the muscles involved in swallowing. Structural problems, tumors, enlarged thyroid glands, or complications from surgery or injury can obstruct the throat. Aging. Natural age-related changes in swallowing function can make it harder for some people to swallow effectively. Esophageal dysphagia, achalasia, the condition where the esophagus muscles fail to relax, making it difficult for food to pass into the stomach. Esophageal stricture, narrowing of the esophagus due to scar tissue, often caused by acid reflux or GERD. Gastroesophageal reflux disease. Esophageal cancer. Tumors in the esophagus can block food passage. Esophagitis, inflammation of the esophagus due to infection, acid reflux, or medication side effects. Foreign bodies, swallowed objects, like food or pills, can become lodged in the esophagus. Scleroderma, a disease that causes the tissues of the esophagus to harden, leading to difficulty with movement. Diagnosis: healthcare provider may conduct a series of tests to determine the cause of dysphagia. Physical examination and a review of the patient's medical history and symptoms. Barium swallow-esophagram. The patient drinks the barium solution, which coats the esophagus. X-rays are taken to track the movement of food and look for blockages or abnormalities. Endoscopy. A thin, flexible tube with a camera endoscope is inserted through the mouth to examine the esophagus, stomach, and duodenum. Esophageal manometry measures the pressure and muscle contractions in the esophagus to evaluate swallowing function. Videofluoroscopic swallow study. The FSS, a specialized X-ray video that tracks the movement of barium-coated food through the mouth and throat. pH monitoring measures acid levels in the esophagus to determine if acid reflux is causing swallowing issues. Treatment for dysphagia. The treatment for dysphagia depends on the cause and type of swallowing problem. 1. Oropharyngeal dysphagia, swallowing therapies, working with a speech-language pathologist to strengthen the muscles involved in swallowing and to learn new techniques to swallow safely. Diet modification, altering the texture of food and liquids to make them easier to swallow, e.g., thickening liquids or softening solid foods. Feeding tubes. In severe cases where swallowing becomes too difficult or unsafe, the feeding tube may be used temporarily or permanently to ensure adequate nutrition. 2. Esophageal dysphagia, dilation. The doctor may use an endoscope to dilate the narrowed esophagus caused by strictures. Medications. Proton pump inhibitors, PPIs, or H2 blockers to reduce stomach acid. GERD is causing esophagitis or reflux. Botox injections. In cases like achalasia, Botox may be injected into the muscles of the esophagus to relax them. Surgery, myotomy, surgery to cut the muscles in the lower esophagus for conditions like achalasia. Tumor removal, in cases of esophageal cancer or benign growths. Lifestyle changes, for reflux-related dysphagia, changes like eating smaller meals, avoiding certain foods, and sleeping with the head elevated may help. Coping strategies and tips: eat smaller, more frequent meals. Large meals can make swallowing more difficult. Avoid dry or tough foods. Stick to soft, well-moistened foods that are easier to swallow. Chew food thoroughly and eat slowly. Drink plenty of fluids. Sipping water between bites can help wash down food. Posture, sitting upright and keeping your head slightly forward while eating can aid swallowing. Avoid lying down immediately after meals. This helps prevent food or acid from refluxing into the esophagus. When to see a doctor if you have persistent difficulty swallowing. If you experience unintentional weight loss, vomiting, or regurgitation. If you frequently cough or choke when eating. If you have frequent heartburn or feel that food is getting stuck in your throat or chest. Conclusion: dysphagia can arise from a variety of causes, ranging from neurological disorders to esophageal blockages. Early recognition and treatment can improve symptoms, prevent complications like malnutrition or aspiration pneumonia, and improve overall quality of life. Proper diagnosis through medical evaluation and tailored treatment plans, including therapies, medications, or surgery, can help manage this condition effectively.